Lots of factors that play into which treatment modality is going to be best for you. Those options may not all be available to you. Those are things you can chat with your Welcome to The Cancer Nurse. I'm Jamie, your friendly neighborhood oncology nurse, and I am going to give you a quick down and dirty description of cancer treatment modalities. Keep in mind that information provided today is not meant to replace a conversation with your oncology team, nor is it meant to be medical advice. So treatment modalities. Modalities just means types, ways of delivering a treatment. In cancer, there are a few of different treatment modalities. The first would be surgical, and that is the best way to get rid of the cancer, to cut it out. But surgery is not always an option, and sometimes even when surgery is an option, there are different modalities that need to be included. Some of those other modalities are things like systemic treatment and local treatment. Systemic treatment is going to mean a full body treatment, which is chemotherapy and immunotherapy. Chemotherapy is anti-neoplastic is the big name of what a chemotherapy drug is. And there's lots of different classes of anti-neoplastic that I will not bore you with because you really probably don't care. But anti-neoplastic agents, what they do is they're delivered intravenously, sometimes through an IV in your arm, sometimes through a central line called a PICC line that's in your bicep area of your arm, and sometimes through a portacath or port, which is usually located in the chest under the skin. It's all considered intravenous systemic therapy, and systemic means it goes out to the whole body. So it doesn't just attack the cancer cell at the specific site, but it is actually delivering that anti-neoplastic agent or chemotherapy to your whole body, so that if there are microscopic pieces of cancer cells floating around, those are going to get attacked as well by that chemotherapy. Immunotherapy is different. Immunotherapy doesn't attack the cancer cell itself. What immunotherapy does, very, very generally speaking, is it helps your own immune system to recognize those cancer cells, recognize that they are not supposed to be there, and then help your immune system attack those cancer cells. So there are also lots of different classes of immunotherapy drugs, which we will not get into today. But immunotherapy can be used in combination with chemotherapy or sometimes alone. And sometimes chemotherapy is used alone, and it really depends on the type of cancer you have and if that cancer has any genetic mutations. But the ultimate outcome is going to be determined by your medical provider or your medical oncologist, who has the knowledge of what your diagnosis is, what and if any mutations your cancer may have, and what is the best way to treat that cancer. The last modality in cancer treatment is radiation therapy. And the most common cancers that are receiving radiation therapy are prostate and breast cancer. However, there are a lot of cancers that get concurrent chemo and radiation therapy at the same time. And those cancers include things like some types of lung cancers, some head and neck cancers, which are things like tonsillar cancer, base of tongue, laryngeal cancer. Another thing that gets concurrent chemoradiation is going to be rectal and anal cancers, and sometimes also cervical cancers. There's lots of factors that play into which treatment modality is going to be best for you and your diagnosis. Those are options that are out there. Those options may not all be available to you, again, depending on your diagnosis and mutations that your cancer has. But those are things you can chat with your cancer provider, whether they're medical or radiation or surgical oncologists, and what options are available to you. Don't forget to like and subscribe, and if you want to join the community, you can scroll down and click on that Patreon link.